Our next health transformer is Yared Alemu. He's with TQIntelligence.
Hello, hello.
Hello. I'm so excited to learn about how you're impacting mental health.
Absolutely.
Tell me.
So we are a child and adolescent behavioral health company. So we've used voice recognition technology to quantify and predict the severity of the emotional behavioral disorder.
It's so cool.
Yeah.
It's so
yeah,
cool
yeah.
because I remember years ago learning a technique
Yeah.
that if you don't try to understand what people say,
Yeah.
but if you listen to the sound of their voice,
Yeah.
you will not only learn what they're telling you, but you will actually understand the emotional component.
Absolutely.
And you
Absolutely.
figured out a way to scientifically
Yeah.
capture that technique.
Yeah, so you take one of those very unique human phenomenons, right? And we use machine learning algorithms to be able to really look at all these idiosyncratic characteristics in voice that are they're biomarkers for stress and trauma. Okay? So I'm a psychologist by training, so I spent a lot of years asking questions and wondering whether the answer I'm getting is something that I can use. But this is moving mental health, especially for children and adolescents, at a whole different level, that now we can objectively quantify the level of emotional distress and then provide that data to mental health providers or other healthcare providers to make decisions about treatment.
You know, I'm a former special ed teacher,
Oh, yeah,
and I did
yeah.
work with children at risk.
Yeah.
And not always can children or adults really explain, verbalize
Yes,
emotionally what's going on, or it could be
That's-
post-traumatic stress.
That's right.
So
That's
to
right.
have a measure
Yeah.
that can almost read your mind by reading the sound of your voice, interpreting.
Exactly. So we're so we work with at-risk kids. So everybody in our pilots, either they're in inner city or rural Georgia. So we have about 8,000 access to 8,000 kids, and so these are ages between 4 and 18. And so what you have in that system is a lot of trauma-based mental health issues that are misdiagnosed, underdiagnosed, overdiagnosed, right? And so the way to really improve outcomes is first to actually get a pretty good baseline functioning, regardless of what the diagnosis is, and then to be able to track that while they're in treatment, so the provider will know whether the interventions, including the medications, are actually working or not. So right now we kind of operate in dark, right? So there's no data, there's no objective data. So what you have is a lot of guesswork that really creates havoc into that system of care.
So just talk to me for 1 second
Yeah.
about how this will change healthcare cost for the family.
Yeah, absolutely. So if you look at the cost of care right now, if you're in the publicly funded system where we focus on, the cost of care is actually $10,000 per patient per year.
Wow.
Compares to about $3,000 on the private side, right? So a lot of money goes into it. There's no transparency, there's no accountability. So what we are doing is providing these objective measurements of stress and trauma and tracking it so we can improve outcomes. At the same time, we're also saving the cost of care.
Fascinating. Thank you so much for
Yep.
joining us at StartUp Health.
Thank you so much.